It's a pleasure to be with you. The title of this session is What Does Public Health Do? There are no disclosures for this presentation. Objectives include review the breadth of public health practice, define the broad mission of public health, discuss the tools to change risky behaviors, define the different approaches to health for clinicians and public health practitioners, discuss the three types of prevention, discuss public health's role in secondary and tertiary prevention, review HRSA designations of underserved areas. When I was appointed as state health officer to head the North Dakota Department of Health, a friend of mine asked why I would leave my current work to focus only on providing health care to the poor. His statement reflects the truth that many, if not most people globally, have little understanding of what public health is and does. Every year since 1873, the American Public Health Association, APHA, has held an annual meeting, a huge event attended by thousands of people containing hundreds of sessions. The sections and caucuses provide insight into the range of current issues and activities considered priorities for public health practice. For example, a recent APHA meeting in 2021 had sections on maternal and child health, alcohol, tobacco, and other drugs, integrative, complementary, and traditional health practices, occupational health and safety, chiropractic health care, physical activity, disability, public health education and promotion, food and nutrition, law and ethics. There was a caucus on academic and practice linkages in public health. Ethnic-specific caucuses included American Indian, Alaska Native, and Native Hawaiian, Asian and Pacific Islanders, and Black health workers. Other caucuses included homelessness, public health and the faith community, refugee and immigrant health, community-based public health, and family violence prevention. This table, though far from comprehensive, demonstrates the diversity and abundance of subjects that concern public health professionals and practice. Full-time public health positions provide insights into the breadth of the field of public health and include national, state, and local public health leadership and administrative positions, along with many other specialized positions as represented by public health workforce job postings at the 2021 APHA annual meeting that included sanitarians, community organizers, health educators, environmental safety specialists, infectious disease managers, epidemiologists, microbiologists, data analysts, and reproductive health specialists. This table represents data from a paper accepted for publication in the Journal of Public Health Management and Practice that analyzed demographic data on 17,339 individuals from the United States, U.S. territories or freely associated states, and 133 foreign countries who accessed North Dakota Public Health Training Network Public Health Practice curriculum offered on the Public Health Foundation's TRAIN platform from August 1st, 2019 to January 5th, 2021. Students represented 11.11% of learners in this study. Of the 88.89% that were non-students, 54.24% identified themselves as associated with health organizations, with 46% of that group identifying with public health and 35.61% with clinical services, with 65.17% of that group being nurses. Administration represented 4.52%, educational institutions 3.96%, and other professions 37.28%, that included first responders, safety and security, military and veterans, social workers, veterinary professionals, consultants, finance, and family support. This study demonstrates the wide range of professions that seek public health practice training, likely reflecting their involvement in the provision of public health services. So what is the common thread that connects these disparate categories of interest and types of employment? A statement written in 1988 by the Institute of Medicine IOM Committee for the Study of the Future of Public Health may help answer that question. The broad mission of public health is to fulfill society's interest in assuring conditions in which people can be healthy. Public health is that thread that seeks to keep people healthy by working through the skills and talents of individuals from myriad disciplines. Public health and the public health workforce is vast. Only 24.9% of non-student learners who accessed public health practice curriculum stated they were from traditional public health organizations and departments, leaving 75% coming from other disciplines. Many individuals involved in public health practice may have little in common on a day-to-day basis, and our knowledge base and skills may vary widely from others. However, our mission is the same, and each of us contributes to public health in some important way. So let's consider the implications of that statement written by the Institute of Medicine, IOM, for a few minutes. The broad mission of public health is to fulfill society's interest in assuring conditions in which people can be healthy. Public health is obligated to ensure health-producing conditions for all people, not just the poor, as mentioned by my friend, not just the rich, but people of all incomes, not only the young or the old, but people of all ages, not exclusively whites, Hispanics, Asians, or blacks, but people of all races and ethnicities. Societal benefits from having a healthy populace is clear in the public health mission's phrase, to fulfill society's interest. The work of public health is a societal effort with a societal benefit. Public health takes the view held by many professions and societies throughout human history that healthy people are more productive and creative, and these attributes create a strong society. It's better for people to be healthy than sick. There will be less dependence, less lost time from productive work, and a greater pool of productive workers, teachers, entrepreneurs, soldiers, and others needed to accomplish society's goals. Society benefits when its people are healthy. Public health acknowledges that health is not guaranteed. People can, not will, be healthy. Public health, through its actions and programs, seeks to create conditions in which people can be healthy. Yet it's ultimately up to individuals and communities to choose to pursue health or not. Public health has a different mission to obtain health than the clinical healing professions, medicine, nursing, dentistry, physical therapy, physician assistants, nurse practitioners, chiropractors, midwives, etc. There are three major sets of tools to change risky behaviors: policy, influencing an individual one-on-one, the clinical, and population-based interventions. Policy is developed by local, state, and federal governments, businesses, and organizations. It is an effective tool to encourage healthy behaviors, but must be implemented and enforced to be effective. Clinicians are trained in one-on-one counseling, another powerful strategy to change risky behaviors. Population-based interventions provide another potent behavioral impact and can be divided into two tool subsets: social marketing, and community engagement. Population-based expertise lies in the discipline of public health. There is significant overlap of policymaker, clinician, and public health approaches to addressing risky behaviors, though each of these groups prioritize on their group's main mission focus. We need to use all these tools in a coordinated, integrated way to change risky behaviors in our populations. One public health primary prevention strategy is to reduce risky behaviors by influencing the conditions or environment in which people live, reflected in the IOM statement, assuring conditions in which people can be healthy. Influencing conditions or the environment of population groups is often related to policy development and implementation from governmental bodies, businesses, and organizations. Developing effective public health policies often requires coordination and integration of public health with policymakers. Examples of public health policies include those addressing lead, asbestos, sanitation, and water treatment, etc. Environment-based prevention strategies clearly distinguishes public health from the clinical professions that focus primarily on one-on-one counseling encounters in a clinical setting. Clinical professions focus on diagnosing individuals and treating health problems detectable by clinical methods, history, physical examinations, laboratory tests, imaging, and so forth. Let's review the three types of prevention: primary, secondary, and tertiary. Primary prevention is eliminating risk factors that cause disease. Primary prevention is intended to prevent the development of disease and the occurrence of injury, and thus to reduce their incidence in the population. Primary prevention includes historic public health emphases on assuring clean drinking water, safe housing and workplaces, and nutritious and uncontaminated food. Primary prevention also includes promoting healthy behaviors, such as using automobile seat belts, protecting skin from ultraviolet light, and refraining from smoking. Public health is the only health profession with the primary mission of primary prevention. Secondary prevention is the detection, treatment, and curing of disease. Early detection is emphasized during screening programs before signs and symptoms of disease are apparent. Secondary prevention activities are intended to identify the presence of disease early, so prompt treatment can either cure or mitigate chronic adverse outcomes. Examples would include screening for breast cancer, diabetes, and hypertension. Tertiary prevention mitigates disability associated with disease. Tertiary prevention focuses on reducing adverse health outcomes to the greatest possible degree. The CDC stated that tertiary prevention concerns managing disease post-diagnosis to slow or stop disease progression through measures such as chemotherapy, rehabilitation, and screening for complications. Secondary and tertiary prevention are the primary mission of clinical care systems and professionals. We need all three types of prevention to improve a population's health and wellness. So clinicians rely on individual or family encounters, one-on-one counseling, focusing on secondary and tertiary prevention, where public health targets large groups of people or populations focusing on primary prevention of risk factors. Clinicians are often identified with the term healer, and public health professionals as preventers. The work of clinicians and public health should be complementary. Both approaches are essential and should be coordinated and integrated to be most effective in impacting health and wellness. The public health emphasis on primary prevention does not mean that public health has no role or interest in secondary and tertiary prevention. Public health professionals are interested and involved in secondary and tertiary prevention. However, Their focus is on ensuring access to effective clinical care rather than providing that directly. Improving access can prevent long-term consequences of health problems and limit disease progression and complications. Access to primary care and the specialties has historically been a target of public health initiatives. Other access issues of interest to public health include transportation to healthcare facilities, cultural competence of healthcare providers, health literacy of patients, the efficiency and effectiveness of healthcare delivery through healthcare reform, and ensuring that all people have health insurance. Let's consider the core public health functions and 10 essential services and how they relate to healthcare access. This slide lists the 3 core public health functions, including 1. The assessment and monitoring of the health of communities and populations at risk to identify health problems and priorities. 2. The formulation of public policies designed to solve health problems. And 3, to assure that all populations have access to appropriate and cost-effective care. The third core function clearly relates to healthcare access. To accomplish the 3 core public health functions, 10 essential public health services were identified in 1994 by the Core Public Health Functions Steering Committee that included representatives from U.S. public health service agencies and other major public health organizations. Those 10 essential services include 1. Monitor health status to identify and solve community health problems. 2. Diagnose and investigate health problems and health hazards in the community. 3. Inform, educate, and empower people about health issues. 4. Mobilize community partnerships and action to identify and solve health problems. 5. Develop policies and plans that support individual and community health efforts. 6. Enforce laws and regulations that protect health and ensure safety. 7. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. 8. Assure a competent public and personal health care workforce. This relates to education and training. 9. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. And 10. Research for new insights and innovative solutions to health problems. Access to healthcare is linked to several of these essential services, but particularly to number 3, inform, educate, and empower people about health issues, improving health literacy of patients, and number 7, link people to needed personal health services and assure the provision of health care when otherwise unavailable. An example of public health's interest in secondary and tertiary prevention is reflected in the U.S. Department of Health and Human Service Administration, HRSA, designation of medically underserved areas, MUAs, medically underserved populations, MUPs, and health professional shortage areas, HPSAs. Medically underserved areas or populations are areas or populations designated by HRSA as having too few primary care providers, high infant mortality, high poverty, or a high elderly population. Health professional shortage areas, HPSAs, are designated by HRSA as having shortages of primary medical care, dental or mental health providers, and maybe geographic, a county or service area, population, for example, low income or Medicaid eligible, or facilities, for example, federally qualified health center or other state or federal prisons. Through designation of medically underserved areas and populations, programs responding to their medical needs have been developed. These programs address concerns about access to quality medical care in specific populations and geographic areas, which is necessary for secondary and tertiary prevention. An infectious disease outbreak provides an example of the complementary roles played by public health and clinical professionals. In 2009, the PulseNet staff at the Centers for Disease Control and Prevention, CDC, identified a multi-state cluster of Escherichia coli, or E. coli infections, mainly from physicians who had diagnosed and treated patients with the disease. CDC's Outbreak Net team then worked with state and local partners, including physicians, to gather epidemiologic information about persons in the cluster to determine if any of the individuals who had become ill had been exposed to the same food sources. They found that most ill persons had consumed beef, many in restaurants. At least some of the illnesses appeared to be associated with products subject to a recent U.S. Department of Agriculture's Food Safety and Inspection Service, FSIS, recall. Public health officials continue to work with FSIS officials to determine the source of the infection and how to prevent recurrence in others. Thus, CDC officials collaborated with local physicians, FSIS, and local public health staff to address the circumstances in which the E. coli infection developed so that others would be spared the illness resulting from exposure to the pathogen. In summary, the control of the E. coli infectious disease outbreak is an example of the promise of public health, collective action that prevents the occurrence of disease, disability, and premature death by assuring conditions in which people can be healthy. Because of public health, people will have the opportunity, to the best of our knowledge and capabilities, to be healthy. Public health as a field and as a collection of practicing professionals will ensure that the environment in which people lead their lives promotes health. Underlying this mission is a commitment to social justice, because it assumes that all people are deserving of healthy conditions in which to live. As Krieger and Byrne argue powerfully, social justice is the foundation of public health. This powerful proposition, still contested, first emerged around 150 years ago during the formative years of public health as both a modern movement and a profession. To declare that social justice is the foundation of public health is to call upon and nurture that invincible human spirit that led so many of us to enter the field of public health in the first place. A spirit that has a compelling desire to make the world a better place, free of misery, inequity, and preventable suffering. A world in which we all can live, love, work, play, ail, and die with our dignity intact and our humanity cherished. The cornerstone of public health is prevention, particularly primary prevention. Prevention is public health's historic and ideal approach to promoting health, and the distinguishing public health prevention strategy is to influence the conditions or the environment in the fullest sense in which people live. How public health has attempted to ensure conditions that promote health is the story of the practice of public health.